The G-spot, a very commonly asked question about the G-spot, that what it is, where is it located, and does it exist or not. So, the medical history of G-spot goes in this way, that it was first found by Dr. Grafenberg, and so in honor of his name it is called as the G-spot, that is a small part present in the front side of the vaginal wall. It is a small spot which is present in the front wall of your vagina. So, if I zoom this picture in, you can see here, so on the front side somewhere approximately here lies the G-spot, which is between your pee hole and your birth hole. So, it is being believed by some school of thoughts that G-spot is the part where there are numerous nerve endings, and so stimulating this part gives pleasure to the female because of the presence of numerous nerve endings. But some school of thought believes that G-spot does not exist. The next is the perineal body. So, when we talk about this term, the perineal body, as we once discussed in the vulva, the perineal body is a thick muscular band. So, your perineal body is present between the birth hole and the poop hole. It is very thick, it is muscular, it has many vaginal muscles that are your pelvic floor muscle attachment, and this is the part which gets torn or which gets cut during the process of childbirth. So, as a female grows older, this portion can also become weaker and less muscular because of multiple events like pregnancy, childbirth, and even the fluctuating levels of estrogen hormones after menopause. So, here in this image you can see, if I zoom this image in, it is the same external area of a female. We have just removed the skin and the other structures, and this red colored structure which you are seeing are your vaginal muscles or your pelvic floor muscles, and just between the two holes, that is your birth hole and your poop hole, lies your perineal body. The anal opening or the poop hole. So, this in the image, if you see, this is the anal opening or the poop hole from where the stool or the feces comes out during the process of defecation. So, the anal opening or the poop hole is the last hole present at the back in these three holes. So, the pee hole, the birth hole and the poop hole. And to all this area, like the area of your private parts, your whole perineal area, this gets the sensations or the nerve supply by the pudendal nerve. And you know from where did this word pudendal came? So, pudendum means a shame or a shameful thing. So, pudendal nerve got its part, that is the nerve for the shameful area, because it was the private parts was considered as a shameful part in the earlier centuries, and so the name came as the pudendal nerve.